I mean, with genital ulcer in the secondary, there will be buccal ulcer also. There will be a generalized rash, generalized lymphadenopathy, and also genital warts. Okay, this is the secondary. Okay, within 1 to 6 months, this has happened. After years, if it is going to the CVS or CNS or forming any skin granulomatous lesion like gammas, then this is tertiary. So tertiary, what if it is going to the skin, gammas, CVS or CNS? Okay, this is important. So what is gammas? There will be like granulomatous lesion in the skin and bone. CVS, what they are doing, usually they are doing with aorta. Okay, usually most of the things syphilis, they are associated with aorta. Then come with the neurosyphilis. Neurosyphilis, they can cause the paralysis, and also it can cause tabes dorsalis. Okay, and also another thing is there, they can cause Argyll-Robertson people, right, in tertiary. Now congenital syphilis, this is so important in part 2. I saved one good picture for you guys. Where is it? Yeah. So if congenital syphilis, what you will get? You see, this is the incisor teeth. It is blunted. So it's congenital syphilis. This teeth will be blunted. First molar teeth, it will be like mulberry appearance. So mulberry first molar, blunted incisor. Okay. Nose could be saddle nose. Deafness can be there. Okay. And they have also one scar at the angle of the mouth. Can you see this one? This one is there called regates. This one. This one. Okay, so this is regates. Also there will be some splitting pupilla, mucosal, this like ulcerative things now would be there, but important is the teeth and this angular lesion. Okay, these are the feature of congenital syphilis. This is important for part 2, because when I was reading, I don't know, it was like marking like there is a question still not tested. Maybe in other chapters they have mentioned the question. So mulberry tooth also, it was important, they mentioned in a question, they underlined that. This blunted also underlined, and this regates also underlined. So don't forget this one. This is the congenital syphilis. Now come with the investigation. So investigation, actually what you have to do, investigation, I have discussed it while we were doing the past medicine. I will discuss it again. So this is like some tests are non-trypanomal. Okay, some non-trypanomal tests are there, and some are trypanomal, are specific. One is non-specific and another is specific. What are the non-specific tests? Non-specific test is VDRL and RPR. And what about the specific test? Specific test is this one, TPHA and this one, trypanoma enzyme immunoassay. These two are specific. So whoever with the name of trypanoma, these are specific. So remember like that, that whoever with the name of T, these are specific. Now, how you will interpret? You have to do non-specific and specific in the both in same patient to diagnose this definitely syphilis or not. How you will do that? If non-specific positive and specific positive, it is active syphilis. Both are positive. If non-specific, somehow it is got is positive, but specific is negative. That means this is not syphilis, right? This is not syphilis. So why did it came positive? The non-specific, maybe some other that we know, the 7 condition are there that that is causing this false positive result. So maybe that's why it is false positive, the first one. Okay, this one we know now, false positive, where we are getting in TB, in leprosy, in malaria, in pregnancy, in HIV pregnancy, then APS, SLE, These 7 conditions, you can get false positive. Now coming, if non-specific is negative and specific is positive, okay, then what is this? Then this one can be so many things. This one either he had previous infection, maybe, okay, which one is already cleared, or maybe this one is latent already, I mean previous infection but not cleared. That one, what we know, it is named as latent, right? If previous but not cleared, this could be, or earlier phase of active infection, acute. So these 3 things, it could be any of them. According to that, you have to, if there is any sign symptom, this is maybe the earlier phase. There is no sign symptom, yeah, it could be either already cleared or maybe latent, not cleared. Okay, so this is the thing how you will interpret the syphilis diagnosis. Okay, investigation. Okay, so syphilis is finished. We are doing it with what? Doxycycline and benzoyl penicillin, right? One thing is that if this TPHA, if positive, it could be positive for whole of your life. But others like RPR, it can be cleared of your body. So once it is positive, the whole life continuous TPHA is positive. This is important, one question from part 2.